I can't write as Dr. Eric Berg or present myself as him, but I can give you an original script in a strong, conversational, root cause health educator style. What I'm about to tell you about your kidneys is going to completely change the way you think about so-called normal aging. If you're over 40 and you've noticed that you're getting up more at night, your energy is dropping, your ankles look a little puffier, or your blood pressure keeps creeping up, you do not want to ignore this. Stay with me because the number one clue your kidneys may be struggling is something most routine checkups still fail to explain clearly. And by the end of this video, you'll know exactly what to look for, what to test, and what to do next. Now, here's the thing. Kidney disease is often called a silent condition for a reason. According to the CDC, about 37 million adults in the United States have chronic kidney disease, and roughly 9 out of 10 don't know they have it. The National Institute of Diabetes and Digestive and Kidney Diseases says early stage kidney disease usually has no symptoms at all. So what happens? You get told your labs are fine. You get told you're just tired because you're older. You get told to drink a little more water, cut back on salt, and come back next year. Meanwhile, the damage can keep building quietly in the background. And that's what makes this so dangerous. Your kidneys don't just make urine. They regulate fluid, minerals, acid-base balance, blood pressure, red blood cell production, and waste removal. So when they start to lose function, the signs can show up all over your body. You may not connect them. Your doctor may not connect them if the visit is rushed. And you may start blaming stress, aging, poor sleep, or hormones when your kidneys are actually trying to wave a red flag. You wake up tired, even after a full night in bed. Your rings feel tighter. Your socks leave marks. You're getting up to urinate at 2 a.m. or 3 a.m. even though you didn't used to. Maybe your urine looks foamier than normal. Maybe your appetite is off. Maybe your blood pressure is a little high, but not high enough to alarm anyone. Maybe you feel itchy for no obvious reason. Maybe your brain feels foggy. And because none of these things seem dramatic on their own, they get brushed aside. But I want you to understand this. Your body is very often giving you signals long before you reach the stage where anyone uses the words kidney failure. Now let's talk about the biggest myth, because this is where most people get it completely wrong. For years, many people have assumed that if their creatinine is in the normal range, their kidneys must be fine. Or if their estimated GFR isn't severely low, there's nothing to worry about. But modern kidney guidelines do not look at kidney health that way. A major review published in JAMA on chronic kidney disease diagnosis and management made it very clear that kidney disease is detected and staged not just by eGFR, but also by albuminuria, meaning protein leaking into the urine. And the 2024 KDIGO guideline, which is one of the most important global kidney references, still classifies chronic kidney disease based on cause, GFR, and albuminuria together. That means you can have a so-called OK filtration number and still be showing early kidney damage if albumin is leaking into the urine. The National Kidney Foundation states that a urine albumin to creatinine ratio above 30 milligrams per gram may indicate kidney disease even when eGFR is above 60. Let me translate that into plain English. Your filter can be damaged before the filter rate looks dramatically bad. In other words, the filter may already be leaking before it completely slows down. And this is why early kidney stress is missed so often. The conversation stays focused on one blood marker. The urine often gets overlooked. Trends over time get ignored. Subtle symptoms get dismissed. What most people don't realize is that your kidneys have a huge reserve capacity. You can lose a surprising amount of function before you feel something obvious. That's not good news. That's the trap. So let me walk you through the 17 hidden signs your kidneys may be struggling years before the problem becomes impossible to ignore. And remember, none of these signs by themselves prove kidney disease. But if several of them are happening together, especially if you also have diabetes, prediabetes, high blood pressure, heart disease, a family history of kidney problems, or a long history of ultra-processed food and common pain reliever use, you need to pay attention. Sign number 1 is waking up to urinate at night more than you used to. This is called nocturia. A 2022 systematic review published in European Urology Focus noted that nocturia can arise early in chronic kidney disease. Why does this happen? Because healthy kidneys concentrate urine during the night so you can sleep. When kidney function starts to weaken, that concentrating ability can become impaired. Instead of holding on to water properly, you make more urine at night. A lot of people assume this is just aging, but that's not always true. Sign number 2 is foamy or bubbly urine that keeps showing up. I'm not talking about a random day when the stream hits the bowl a certain way. I'm talking about persistent foam. The JAMA review points out that foamy urine can be a sign of albuminuria. Albumin is a protein that should stay in your bloodstream. If the tiny kidney filters called glomeruli are damaged, protein can leak through. That foam may be one of the earliest visible clues that the filter is getting porous. Sign number 3 is puffiness around the eyes, especially in the morning. This one gets overlooked all the time. When protein leaks out of the blood and into the urine, fluid balance shifts. One of the first places you may notice it is around the eyes, because the tissue there is very thin. If you wake up looking swollen and it keeps happening, don't just blame allergies or sleep position. Sign number 4 is swelling in the ankles, feet, or lower legs. Maybe your shoes feel tighter. Maybe your sock lines are deeper than they used to be. This can happen when the kidneys struggle to regulate sodium and water. Fluid starts accumulating in the tissues. Now, swelling can have other causes too, like vein problems, heart issues, or certain medications. But kidneys are absolutely on the list. Sign number 5 is blood pressure that keeps creeping up or gets harder to control. This is critical. High blood pressure is not only a cause of kidney damage, it can also be a consequence of it. Your kidneys help regulate blood pressure through fluid balance and hormonal signaling. When they're under stress, that system can go off track. So if your pressure is rising for no obvious reason, or you suddenly need more medication to keep it in range, your kidneys deserve a closer look. Sign number 6 is fatigue that doesn't match your activity. The Mayo Clinic lists fatigue and weakness among the symptoms of chronic kidney disease, especially as it advances. But the reason matters. As kidney function declines, waste products can build up in the blood. On top of that, the kidneys normally help produce a hormone called erythropoietin, which tells your body to make red blood cells. If that signal drops, anemia can develop and you feel exhausted, weak, cold, or short of breath. That leads to sign number 7, which is brain fog or decreased mental sharpness. If your focus is slipping, if you feel mentally dull, if you can't think as clearly as you used to, don't automatically assume it's just age. The Mayo Clinic specifically notes decreased mental sharpness as a symptom of more advanced kidney disease. When your kidneys don't clear metabolic waste effectively, your brain can feel it. Sign number 8 is dry, itchy skin. Cleveland Clinic lists dry, itchy skin as a symptom of chronic kidney disease. And the JAMA review also mentions pruritus, which is the medical word for itching. Here's what's actually happening. Your kidneys help regulate minerals and remove waste. When that balance starts to break down, your skin can become dry and irritated. A lot of people chase lotions for months and never ask why the itch started in the first place. Sign number 9 is muscle cramps. This can relate to shifts in fluid, sodium, potassium, calcium, or magnesium balance. When kidney regulation becomes impaired, muscles are often one of the first places you feel it. Nighttime calf cramps, foot cramps, random muscle tightening, especially when it's new or persistent, should make you curious. Sign number 10 is trouble sleeping. And this is not just because you're getting up to urinate. The Mayo Clinic lists sleep problems in chronic kidney disease, and Cleveland Clinic does too. Sometimes it's fluid imbalance, sometimes it's itching, sometimes it's restless legs, discomfort, nighttime urination, or changes in the nervous system caused by waste buildup. If your sleep suddenly falls apart without a clear reason, don't ignore the connection. Sign number 11 is a metallic taste in the mouth or breath that smells unusually strong, stale, or ammonia-like. When waste products accumulate, they can alter taste and odor. Food may taste off. Meat may become less appealing. You may notice a weird chemical taste you can't explain. That is not normal. Sign number 12 is a drop in appetite. The Mayo Clinic lists loss of appetite as one of the classic symptoms that can show up as kidney disease worsens. If you're skipping meals, not because you're trying to, but because food just doesn't sound good anymore, that matters. Sometimes this shows up before any obvious pain or major illness. Sign number 13 is nausea. Again, Mayo Clinic lists nausea and vomiting among chronic kidney disease symptoms. When waste products accumulate, your stomach and digestive system often feel it. You may not be vomiting, but you may feel slightly queasy, especially in the morning. You may think it's stress, reflux, or just getting older. It may not be. Sign number 14 is shortness of breath, especially with fluid retention or anemia. Mayo Clinic specifically notes shortness of breath if fluid builds up in the lungs, and anemia can also make you feel winded because your tissues aren't getting oxygen efficiently. If climbing stairs suddenly feels harder or you get breathless more easily than before, your kidneys may be part of the story. Sign number 15 is a change in urine amount, color, or the presence of blood. The JAMA review mentions gross hematuria, which means visible blood in the urine, as one of the presenting signs that can occur. Some people notice darker urine, some notice less urine, some notice urgency or frequency changes. No single change proves kidney disease, but persistent changes deserve evaluation. Sign number 16 is low hemoglobin or unexplained anemia on a blood test. This one is hidden because you might not feel anything dramatic at first. You just feel more tired, more fragile, more out of breath. In that same JAMA review, anemia was described as one of the most common complications of chronic kidney disease. So if your hemoglobin is drifting down and no one is asking why, kidneys should be part of the conversation. And sign number 17, which may be the most important hidden sign of all, is albumin in the urine or a slow downward trend in kidney filtration that gets labeled still normal. This is the part nobody talks about enough. The National Kidney Foundation explains that albumin in the urine is an early sign of kidney damage. KDIGO's 2024 guideline continues to emphasize both albuminuria and GFR in kidney assessment. And that means you don't wait until kidney numbers are terrible. You catch the leak early. Now let me explain why these signs happen in the first place. Because if you understand the mechanism, you'll never look at them the same way again. Think of each kidney as a dense cluster of millions of tiny filtering units. Blood flows in, pressure pushes waste and extra fluid through, and your body carefully reabsorbs what it wants to keep. Protein should stay in the blood. Toxins should leave. Water should be balanced. Minerals should stay in a very tight range. Blood pressure should be regulated. Red blood cell signaling should stay on. That's an enormous workload. When blood sugar stays high for years, those tiny filters get damaged. When blood pressure stays high, those tiny blood vessels are exposed to too much force. When inflammation is chronic, when smoking is present, when ultra-processed food dominates the diet, when common nonsteroidal anti-inflammatory drugs are used frequently, when dehydration repeats over and over, when metabolic syndrome is brewing in the background, the kidney tissue starts taking a hit. It may be subtle, but it adds up. And here's the missing piece. Early kidney damage is often vascular damage. It's a blood vessel problem before it becomes a full-blown filtration collapse. That's why albumin leaking into the urine matters so much. It's telling you the barrier has become injured. You're not just seeing a kidney problem, you're seeing a small vessel problem. That's also why chronic kidney disease and heart disease so often travel together. This is going to surprise you, but your kidneys are also deeply connected to your metabolism. According to the CDC, chronic kidney disease is far more common in people with diabetes, high blood pressure, and even prediabetes. When insulin resistance drives blood sugar higher, oxidative stress and inflammation rise. The kidneys have to filter that blood every minute of every day. Over time, the filter pays a price. And this is where most people get it completely wrong. They wait for pain. But early chronic kidney disease usually doesn't cause kidney pain. You can have significant damage and feel almost nothing directly in the kidney area. That's why relying on dramatic symptoms is such a mistake. The real early clues are functional clues, urine clues, swelling clues, blood pressure clues, fatigue clues, lab trend clues. So here's what you need to do if you want to protect your kidneys before bigger damage occurs. First, ask for the right testing, not just creatinine, not just your labs look okay. Ask for a urine albumin to creatinine ratio, your eGFR, your serum creatinine, your blood pressure trend, fasting glucose, A1C, and a full metabolic panel. If the picture still doesn't make sense, ask whether cystatin C would help refine the estimate of kidney function. The reason is simple. You need both the leak test and the filtration test. If you only check one, you can miss the story. The second thing is to take blood pressure and blood sugar seriously, even if they're only mildly abnormal. Mildly abnormal over many years is exactly how silent damage happens. If your blood sugar is creeping up, If your A1C keeps climbing, if your waistline is expanding, if your pressure is living in the high range more often than it should, don't wait. That is kidney prevention time, not see you next year time. The third step is to remove the foods and habits that keep injuring the filter. Start with sugary drinks, excess refined carbohydrates, ultra-processed snack foods, and the hidden sodium overload that comes from packaged meals, deli meats, fast food, and restaurant food. I want you to understand this. It's often not the salt shaker at home. It's the industrial food supply. Excess sodium pushes blood pressure up and increases fluid burden. Excess sugar and refined starch worsen insulin resistance and vascular damage. That combination is brutal for kidney tissue. The fourth step is to build your meals around whole foods that support metabolic health and blood pressure control. That means non-starchy vegetables, leafy greens if appropriate for your condition, berries, olive oil, garlic, onions, fish, eggs, beans if they fit your plan, nuts in reasonable amounts, and minimally processed proteins. If you already have diagnosed kidney disease, especially more advanced disease, your protein, potassium, phosphorus, and sodium targets may need to be individualized, so don't turn this into a one-size-fits-all diet. But for prevention and early risk reduction, whole foods beat processed foods every time. The fifth step is to get moving after meals. This one thing alone could change a lot more than you think. A simple walk after eating helps improve glucose control, lowers post-meal blood sugar spikes, and supports blood pressure and circulation. You don't need some perfect workout plan to start protecting your kidneys. You need consistency. The sixth step is to protect your sleep. If you're sleeping 5 hours, waking 3 times a night, and living on stress hormones, your blood pressure, blood sugar, and inflammation all get worse. And that feeds kidney damage. Go to bed earlier, cut the late night snacking, get morning light, reduce alcohol if it's affecting your sleep. These basic things matter. The seventh step is to review your medications and supplements with a clinician who understands kidney health. This is very important. Many people assume that if something is over the counter, it must be harmless. Not true. Frequent use of common non-steroidal anti-inflammatory pain relievers can stress the kidneys, especially if you're dehydrated or already at risk. Certain herbal products, bodybuilding supplements, and high-dose combinations can also be a problem. Even helpful nutrients like magnesium or vitamin D need context if kidney function is impaired. The right nutrient for the right person can be beneficial. The wrong one in the wrong situation can backfire. The eighth step is to hydrate intelligently, not obsessively. More water is not always better. Too little can be a problem, but forcing massive amounts isn't automatically protective either. What you want is steady, appropriate hydration based on your body, climate, activity, and medical history. If you have heart failure, advanced kidney disease, or fluid retention, hydration advice needs to be individualized. The ninth step is to stop smoking if you smoke. This should be obvious, but it has to be said. Smoking damages blood vessels, increases oxidative stress, worsens kidney disease progression, and raises cardiovascular risk on top of it. If you needed one more reason to quit, here it is. The 10th step is to monitor trends, not one isolated number. This is where patients lose ground. A slightly worse eGFR gets ignored. A little albumin in the urine gets brushed off. Blood pressure is not too bad. Then a year later, everything is worse. KDIGO emphasizes repeat assessment, and the National Kidney Foundation notes that persistent albuminuria over time matters. So compare labs, watch direction. Don't just glance at a reference range and assume you're safe. And here's another powerful point. If you have diabetes, prediabetes, or high blood pressure, don't wait for symptoms at all. According to the CDC and NIDDK, those are major risk groups. Screening is not paranoia, it's prevention. If kidney disease runs in your family, if you're over 60, if you've had years of metabolic problems, if you've used a lot of pain relievers, if you've been told your pressure is borderline for years, you have even more reason to be proactive. Now, I promised you the number one thing most people miss. Here it is. It's not a dramatic symptom. It's not back pain. It's not some magic supplement deficiency. It's albumin leaking into the urine before the standard conversation about kidney disease ever begins. This is the quiet clue. This is the early warning. This is the sign that the filter may already be damaged, even if your creatinine hasn't scared anyone yet. That's why the urine albumin to creatinine ratio is such a big deal. The National Kidney Foundation says a value above 30 may mean kidney disease, even if eGFR is above 60. In plain language, your kidneys can still be filtering at a level that looks acceptable on paper, while quietly leaking protein they should not be losing. If you only remember one thing from this video, let it be this. Do not let anyone tell you that a single normal kidney number automatically means your kidneys are fine. Ask whether your urine has been checked. Ask whether the trend has been reviewed. Ask whether your risk factors have been taken seriously. And one more thing, please do not panic if you recognize yourself in several of these signs. Swelling can come from other causes. Fatigue can come from other causes. Itching can come from other causes. The goal here is not fear. The goal is earlier awareness, earlier testing, earlier intervention, because kidneys usually don't fail overnight. They decline over time. And the earlier you catch the pattern, the more options you usually have to slow or even prevent progression. Your body is always giving you information. The question is whether you know how to read it. Waking up at night to urinate, foam in the urine, swelling around the eyes, ankle puffiness, rising blood pressure, fatigue, brain fog, itchy skin, cramps, sleep problems, metallic taste, low appetite, nausea, shortness of breath, changes in urine, anemia, and especially albumin in the urine. These are not random annoyances to brush aside forever. They may be your early warning system. If this video helped you, share it with someone you care about, because there's a very good chance they're dismissing one of these signs right now. And if you want to go deeper, the next thing you should learn is how blood sugar, blood pressure, and ultra-processed foods quietly damage the kidneys long before dialysis is ever on the table. Remember, the earlier you catch the stress, the more power you have to change the outcome. Your body has an incredible ability to protect and repair when you remove the things that are hurting it and give it the right support. I'll see you in the next video.